Hi, I'm Dr. Eric Brooker. I'm here with you today to present a webinar on billing and coding for punctal occlusion for the treatment of dry eye syndrome or other ocular surface disease that can affect the eyes. This webinar and presentation today is brought to you on behalf of La Rivera, who supplies some of the best plugs that we use currently in our office in Las Vegas. Dry eyes is one of the most common conditions that comes into an optometric practice on a daily basis. Patients present to the office with burning, itching, red eyes that lead to blurry and fluctuating vision. This type of vision can affect your patients on a daily basis, from work performance to enjoying their everyday activities of daily living. So today we'll be examining closely, as I said, billing and coding for punctal occlusion in the treatment of dry eye disease. Now, in my office, before we start treating patients with punctal occlusion, we first try to eliminate the inflammation in the eye. And we have another series where we're going to talk about when to use plugs and what plugs to use. But I just wanted to touch on that briefly is before you start doing punctal occlusion, you want to make sure you decrease the inflammation in the eye so you get the most effectiveness from the punctal occlusion treatment. Now, as an optometrist, you have to realize this is a surgical procedure. Although it's a minor surgical procedure, it is coded as such. And so the code for punctal occlusion is 68761. And that is your CPT code. So any 68 code that's a CPT code is recognized as a surgical procedure when you're looking at your private insurers as well as Medicare. So it's the same code no matter what type of insurance you're billing, whether that's private insurance or Medicare insurance. So that's the first thing we want to look at. So your code is 68761. This particular code has a 10-day global period. What does that mean? Well, it means if you do a procedure, 68761, and you see that patient within that 10-day global period, you cannot charge the medical insurance, whether that's Medicare or private insurance, any type of additional fees. So it falls within that post-operative period. As soon as you hit day 11, then you can move into being able to do other procedures for that patient or other type of follow-up. And that's something that's very important to remember. Many doctors will do a staged procedure, and this is where they're going to do a collagen plug test first, and that would be like a 7-day collagen plug. And this is going to be more of a test to see how a patient would respond to punctal occlusion, because those plugs are only going to last about 7 days and then they're going to evaporate. This is also a very good strategy as far as reimbursement goes for the doctors, and the medical insurances like that because they know that you're testing the procedure to make sure it's going to work before you do something more permanent. In the eyes of Medicare and private insurance, they view a temporary plug versus a long-term silicone plug exactly the same. It's the same code. It's 68761. The allowable for that can be upwards of $190, depending on how many plugs are done on a patient, but that's going to vary in the individual states as well. So let's take a look at that. So let's start with a situation where a patient comes in, you've been treating their dry eyes or their allergies, and now we're ready to try punctal occlusion. Patient first goes through an informed consent process. You want to make sure and document your informed consent. Document everything you do. In fact, if you're doing a procedure with a 6A code in your office, you want to be having some type of op report or something that you have in the patient's chart that if you do get audited by one of these insurances, you have proof that you did the procedure. So if you have documentation, you have something you can show them. In our office, we do exactly that, whether it's collagen plugs or punctal plugs. So if we're doing a dissolvable collagen plug, we use a dissolvable collagen plug consent. And for a silicone plug, we use a silicone permanent plug consent. And you want to document everything you've done on that sheet. We combine that with our informed consent, which the patient signs, which shows that the patient was in office and the procedure was performed. You never want to get caught after the fact during an audit where the insurance company is asking for that type of documentation and you don't have anything. So moving on. So let's go back to this code 68761. Now, when you're seeing a patient, first of all, they're going to be coming to your office and you're going to decide what type of CPT code you're going to code for that office visit. Most commonly, it's going to be as a follow-up procedure because you've probably seen this patient before. And that's probably going to be about a 99214 code. Again, that's 99214. Now, if you do not see the patient for a different ICD-10 code as far as why that patient was being seen in your office, then they're going to probably bundle the payment for the 99 code with your surgical procedure code. So for instance, let's say a patient's coming in and you code a 99214 with a dry eye ICD-10 code, and that's your only code. Well, in that situation, the payer is not going to reimburse your office for the 99214. A different scenario would be where a patient came in for a monitoring of their glaucoma IOP. With that particular code, if you had ICD-10 code for glaucoma and your secondary code was a dry eye condition, you are also going to get reimbursed for the 99214 CPT code. So let's say you have your 99214 code. With that, if you're going to be doing a procedure the same day, which is going to be your punctal occlusion, your 68761, no matter if you're using a private insurer or Medicare, you've got to use a 25 modifier. The 25 modifier is crucial, and that's going to be attached to your CPT, your 99214 code. So you have your 99214 with your modifier 25. So that's the first part that you want to have on your billing that's going to be sent in to the payer. The next step is the procedure. There's two ways to approach this, and that's going to vary whether you're billing Medicare or a private insurer. So now as we get back into looking at the 68761 code, that's going to be the CPT code that you indicate for punctal occlusion. It's going to vary how you code this depending on the number of plugs you do. So let's start with the most common scenario. And the first one that we were discussing, where we're going to put collagen plugs in the patient's eye to see if they respond well to the test. When you do collagen plugs, the best thing to do is to do a plug in each duct. So that's going to be 4 plugs total. And that's going to pretty much simulate what it would be like to do just one permanent plug in each eye. So that's a good way to do the test. And you can have that patient report back to you the results of the treatment to see how effective it was. When you're coding this and you put down your 68761 code, the first code that you put down on your billing sheet is going to need to have a modifier 50, okay? And the next code that you're going to put down is going to be another 68761 code, and this is going to have on the same line a modifier 50 and a modifier 51. And this is going to ensure that you get reimbursement for all 4 plugs, and it indicates a bilateral procedure with the top and bottom tear ducts all being occluded. Okay, now that you've transitioned to doing the collagen plug test with your patient, the patient's had a positive response to the test, the next step is to bring your patient back beyond that 10-day global period. It could be day 11, 12, 13, as long as it's not at day 10. And at this point, you're ready to do your silicone plugs to really help your patients. And your patients are going to get even a better response from the silicone plugs. With this billing scenario, you're going to use your office visit code 99214 as your CPT. You need to have a 25 modifier associated with that. And that's going to tell the insurance company that you're doing a separate procedure on that same day. So in this scenario, let's pretend that we're doing a inferior silicone plug on both the right eye and the left eye. So we're going to need 2 different line items for this coding. You're going to use your surgical procedure code 68761, the same one we used before, but you're going to use your modifier E2 on that first line. As you go to the second line, you're going to again use 68761. You're going to need a 51 modifier, and then you're going to need a second modifier on that line item, which is going to be the E4. Now that you have both lids covered, so you can do it just like that. With Medicare, a lot of times they don't require the 51 modifier, but it's not going to hurt to go ahead and use that. I think that's an easy way to go to just make sure you're safe and that you don't get any denials for your Medicare patients as well. So the next scenario we're going to move on to, and this can happen in some situations where you have one eye that is more dry than the other. For instance, in this scenario, we'll just say the right eye is more dry than the left. That eye is going to require 2 punctal plugs and maybe only 1 punctal plug for the left eye. So again, in this situation, you would do a 99214 for the CPT code for the office visit. You would again need your 25 modifier, and then you're going to go to your next line item. On this line item, you're going to have a 68761, and you're going to indicate, let's say, for instance, on the right eye, you would do an E2 and E3, but in the number of units, you would indicate 2 units. Okay, and so anytime you're billing multiple procedures on one eye, you want to indicate the number of units. That way you're ensured to get the maximum reimbursement. As you You go to your next line item for the left eye, you do a 68761 code as well. You'd need a 51 modifier, and you'd also just indicate 1 unit. And that would be for your second line item. But you have to also indicate your E code as well, indicating which lid you did on the left eye. So for instance, if it was the upper lid, it'd be an E1, and that would be fine. That would work perfect. This webinar today is brought to you on behalf of Lacravera, who is the manufacturer of some of the best plugs that we use in our office.